Hi, my name is Candy Berdan. In this video, I'll be presenting a current trend in healthcare informatics. What is transition of care? Agency for Healthcare Research and Quality stated that this is the changeover of a patient from one healthcare setting to another, such as ambulatory care practices, long-term healthcare facilities, home health, and rehabilitation facilities. During this transition, a thoughtful and thorough discharge process play a vital role to maintain the continuity on the elements of care, such as diagnosis and follow-up plans. It is added that poor transition of care in discharge planning and education pose a great risk of adverse effects that are correlated to poor patient follow-up and miscommunication. The current event chosen to be presented entails an enhancing patient transition of care by improving communication, coordination of care, and increasing patient and family engagement with the use of video conference. Among the 7 technology trends for 2019, according to Referral MD website, is telemedicine. Telemedicine allows technology systems to connect healthcare providers with their patient without stepping out of their homes or stepping into the physician clinic. A research study conducted by Knight, Trinkle, and Channon is used to provide the clinical implications of telemedicine, specifically video conference, how this can enhance transition of care. The purpose of the research is to evaluate the effectiveness and acceptability of structured face-to-face handoff via video conference in improving transition of care between hospital and home health care. The study was conducted in a piloted pediatric department in a Midwest health system. The research was conducted for over a 2-month period on patients who were discharged from the pilot department. During discharge teaching, the bedside primary nurse uses a handoff toolkit and checklist that contains data needed during video conference between the home care nurses to ensure that the data is consistent, accurate, and time is managed well. During video conference, the patient and family members are introduced to the home health nurse. They were involved during handoff communication and kept them engaged by asking them questions. In addition, bedside nurse would conduct assessment of pertinent concerns such as their wounds, incisions, drains, indwelling tubes, or central lines. Discharge teachings are also reiterated by the home health nurse for reliability and consistent message from bedside nurse and home health nurse. Evaluation of research was done through chart audits and patient surveys. The results of studies were obtained from 16 total video conference opportunities, 10 of which were successful and 6 were missed due to untimely notification and scheduling. Effectiveness of video conference showed that home health nurse given and received the vital information during handoff. Both bedside nurse and home health nurse found value in the handoff. Furthermore, the patient and family were relieved by their anxiety of going home and felt that they were ready to go home. Patients stated that the process was very reassuring. The acceptability of video conference was strong and improved over the 2-month period. Although there were limitations in the research study, such as small sample size, conducted in one inpatient unit only, and limited patient population. The research study, however, proved that there was an improvement in care transition of patients who were discharged from the pediatric clinic. With the use of video conference, patients and their families were provided an opportunity to meet online their home health nurse. They can initiate a connection or build relationship and rapport during the initial face-to-face experience. It alleviates the family and patient's anxiety of going home, and that there is a comfort level displayed by the patient and family during the home health nurse first initial visit. The recommendations to implement video conferencing should include streamlining the schedule and timing of the conference, coordinate with the Health Information Technology Department to assess and evaluate the Wi-Fi connection, select the best device for video conference, and provision of assistance to user when technical issues arise. With the advances of use of technology in healthcare organizations and providers must capitalize in modern technology and must be willing to be innovative. This research study is important because it can close the gaps in care transitions. The patient family will be empowered on their follow-up care, avoid errors such as medication errors, patient dissatisfaction, and 30-day readmissions can be prevented.